If you have pain or difficulty lifting your leg to get your pants on, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain why you may have difficulty lifting your leg to get your pants on and what to do about it. Now, one really common reason why people have pain and or difficulty lifting their leg to get their pants on is because of hip arthritis. And to lift your leg to get your pants on, you need to have three things. You need to have the range of motion available to lift your leg. You need to have the strength to lift your leg. And you also need the strength and balance in the opposite leg to be able to stand while you're lifting the other leg to get your pants on. And so we're going to go over all three of those problems and solutions you can use for each of them so that you can get your pants on with less pain and difficulty. Now, problem number one is the range of motion. And if you don't have that, the other ones don't matter. So to be able to get your pants on, you need to really be able to reach down to your foot. And if you can't reach your foot while you're sitting, then you're not going to be able to do that when you're standing. Now, people think about lifting their leg to get their pants on, and it's not all that high. You may not have trouble lifting your leg to go up a step like that, but when you are already bent over, you're already flexed about 90 degrees at the hip. Then you have to try to lift the leg even farther to take a step to get your foot up high enough to get the pants underneath it. So to be able to get your pants on, you really need to be able to reach the bottom of your foot when you're sitting down. And so to do that, you've got to have roughly around 120 degrees of hip flexion. And if you don't have that, that's the first place to start. So one way that you can help improve your hip range of motion from a sitting position is just taking your hands and putting them underneath your knee and then using your hands to lift the knee up toward your chest. And if you can't get it pretty close to up to your chest like this, then you're going to need to get that range of motion before you can even start to think about strengthening. Now, what are some things that limit your range of motion in hip flexion? Well, it can be the arthritis in the hip joint itself, but it can also be muscular issues or capsular issues that are preventing you from getting the range of motion. Now, when you stretch your hip up like this, if you feel a pinching in the groin, you don't want to push past that because your hip joint is actually in the groin. Many people think that the hip joint's out here, but it's actually in the groin. So if you're lifting your leg and you feel a pinching pain right there, you don't want to try to stretch through that. That's about where you would stop. But other things that can limit your hip flexion range of motion are the muscles and the capsule in the back of the hip. Your hip is a ball and socket joint, and as that ball rolls towards the front of your body in order to lift your leg up, it also has to glide backwards in the joint. And if you're too stiff in the muscles in the back of your hip, then that can limit your ability to lift your knee forwards or lift it up into hip flexion. So one good exercise is, like I said, lifting up with your arms like that. Another exercise that helps stretch the muscles in the back of your hip, the piriformis is the most common one that people think of, but there are 6 little muscles in the back of your hip that can limit your mobility. And one way to stretch those is trying to cross your leg. Now, if you're having trouble lifting your leg to put your pants on, chances are pretty good that you may have difficulty crossing your leg to do a traditional piriformis stretch like this. But there are a couple of alternatives. You can either just lift like that and go up as high as you can comfortably and just hold it in that position. Or if you're really limited, then you can place your foot up on the opposite knee and just stretch like that. But you only want to go to the degree that you can without causing groin pain. If you get a stretching pain in the side of your hip or in the back of your hip, and it's just a little bit of mild discomfort, that's okay. But when you're stretching, you want to avoid that groin pain because that's really where you're just pressing bone on bone and you're not going to get past it, and it's probably just going to irritate things and make it mad. So step number one is get your mobility by either doing a knee to chest, either in a seated position, or you can also do it laying down. But you're going to need to be able to do it in a seated position before you can get up and do it to a standing position. And the other option is the crossover like this, doing a partial piriformis stretch, and then when you're able to get farther, doing a full piriformis stretch like that to stretch the muscles in the back of the hip. Now, once you've gained the range of motion to be able to lift your leg high enough passively, then you need to start to develop the strength to be able to do that actively. Because again, when you're trying to get your pants on, you're bent over to 90 degrees, and then you're trying to lift that last 20 or 30 degrees actively. So you need to strengthen your hip flexors when they're already in a shortened position. And one of the best ways to do that is to lift up to the end range and then practice holding it there. So you use your hands to lift the knee up, and then you use your muscles to keep it there. Now, if you just let go, you may notice that you fall a little bit. You may notice that you lose it and then you catch it again. That means that you're strong once the muscle has been lengthened, but you're not strong with the muscle in the shortened position. And you need to be strong throughout your entire range of motion, and particularly in that shortened position for the purpose of getting your pants on. So you can sit down in a chair, lift the leg like that using your hands, and then practice holding it there. And if you can't hold it there just using your muscles, then you can use assistance from your hands. So pick it up using your hands only, then hold it there using just enough help from your hands to keep it in that position without letting it fall to a more lengthened position. So that's step number 2, the strengthening of your hip muscles. Now, step number 3 is once you can hold here and you've got the range of motion to do it and the strength to hold in that position, you still need the balance to be able to do it in standing while balancing on this opposite leg. And so if you can't hold the stability on this leg, then you're not going to be able to get your pants on. And so one of the best ways to practice that initially is just practicing standing on one leg without bending over. And once you can stand on one leg without bending over, then you're ready to start progressing to standing on one leg while bending over. Now, before you go straight to doing it with hip flexion on this leg, you may try doing a golfer's bend type exercise. And you might need to hold on to something like a chair or a bed initially. Practicing doing that hip hinging or golfer's bend on the opposite leg, where this leg is not flexed up all the way. And then once you have the balance and stability to do that, then bring the other leg up. And if you can get to this point where you can kind of reach the bottom of your foot in a standing position, you're probably at a point where you're no longer having trouble putting your pants on. But what do you do if you have really bad hip arthritis? What if you are stretching and you just can't get past that bone-on-bone groin pain? Well, if you turn your knee out a little bit, that does allow you a little bit more range of motion. So you might notice that you can get a little bit farther like this if you turn your knee out. So that's one option. It kind of gives you a little more space in the hip joint. If you still have trouble, even when you turn your hip joint out, chances are you might be getting close to a hip replacement. But if you're not ready for that, or you have contraindications that keep you from having that type of surgery, or you just don't want to do it because you don't like the risks, there are alternatives. And one of them is using a pants helper, where you just clip it onto your pants and then you pull the pants up using the pants helper. And I'll put a link below this video to where you can get one of those on Amazon. But just to summarize what we learned in this video, number 1, there are 3 things that keep you from being able to put your pants on if you have hip arthritis. It might be that you lack range of motion, it might be that you lack strength to hold it there, and it might be that you lack balance on your opposite leg to stabilize yourself. And if you're missing any one of those 3 things, then you're probably going to have trouble lifting your leg to put your pants on. Now, if you need some more help for hip arthritis and you're in the St. Louis area, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else and you'd like more tips about hip arthritis, check out these other videos over here. But before you go, if you found this video helpful, give it a like, and if you haven't already, subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.